Question 23. A client with chlamydia is prescribed doxycycline. What is the priority teaching? A. Take the dairy products. B. Avoid sun exposure and finish all antibiotics. C. Stop when symptoms resolve. D. Expect pink urine.
Answer is B. Avoid sun exposure and finish all antibiotics. Rational, doxycycline causes photosensitivity. Stopping early causes resistance. Incomplete treatment leads to PID and infertility. Memory click, doxy equals don't go in the sun.
Question 24. A client in labor has meconium-stained fluid. What should the nurse prepare for? A. Normal delivery. B. Neonatal resuscitation at birth. C. Immediate C-section. D. No intervention needed.
Answer is B. Neonatal resuscitation at birth. Rational, meconium increases risk for meconium aspiration syndrome. No, I will tell you why this is dangerous. The newborn may need suction and oxygen immediately after birth. Memory click, green fluid equals get ready for baby.
Question 25. A client with cervical cancer is receiving brachytherapy. What is the priority safety measure? A. Limit visitors to 30 minutes. B. Private room with lead shielding. C. Maintain NPO status. D. Encourage ambulation. Answer is B. Private room with lead shielding. Rational. Brachytherapy is internal radiation. Staff and visitors need distance and shielding. No, I will tell you why this is dangerous. Radiation exposure can harm others. Memory click, brachy equals back away.
Question 26. A client with menopause reports hot flashes. What is the priority non-pharmacologic teaching? A. Wear heavy clothing. B. Layer clothing and avoid triggers like caffeine. C. Increase red meat intake. D. Avoid exercise.
Answer is B. Layer clothing and avoid triggers like caffeine. Rational. Layering and trigger avoidance reduce hot flash severity. No, I will tell you why this is dangerous. Triggers worsen vasomotor symptoms and sleep disruption. Memory click. Hot flash equals hit the layers. Question 27. A client with gestational hypertension should be monitored for progression to what? A. Hypotension. B. Preeclampsia. C. Diabetes. D. Anemia.
Answer is B. Preeclampsia. Rational. Gestational HTN can progress to preeclampsia with proteinuria and organ involvement. No, I will tell you why this is dangerous. Preeclampsia risks seizure, stroke, and fetal demise. Memory click, HTN in pregnancy equals watch for protein. Question 28. A client with ovarian cancer has ascites. What is the priority assessment? A. Abdominal girth and lung sounds. B. Pedal edema only. C. Bowel sounds only. D. Temperature only.
Answer ISA abdominal girth and lung sounds. Rational. Ascites compresses the diaphragm and lungs. No, I will tell you why this is dangerous. Fluid can cause respiratory compromise and requires drainage. Memory click. Ascites equals airway and abdomen. Question 29. A client is undergoing an amniocentesis. What is the priority post-procedure teaching? Arrest and monitor for leaking fluid or bleeding. B. Immediate ambulation. C. Take a hot bath. D. Resume intercourse. Answer ISA. Rest and monitor for leaking fluid or bleeding. Rational. Amniocentesis risks rupture of membranes and infection. No, I will tell you why this is dangerous. Leaking fluid can mean fetal compromise and infection. Memory click. Needle in sac equals no activity. Question 30. A client with syphilis in pregnancy is at risk for what? A. Macrosomia. B. Congenital syphilis and fetal demise. C. Preeclampsia only. D. Gestational diabetes. Answer ISB. Congenital syphilis and fetal demise. Rational. Syphilis crosses the placenta and causes stillbirth or birth defects. No, I will tell you why this is dangerous. Untreated infection is fatal to the fetus. Memory click. Syphilis equals sick baby. Question 31. A client with vaginal candidiasis should be taught to do what? A. Douche daily. B. Wear cotton underwear and avoid tight clothing. C. Use scented products. D. Increase sugar intake.
Answer is B. Wear cotton underwear and avoid tight clothing. Rational. Yeast thrives in warm, moist environments. No, I will tell you why this is dangerous. Douching and synthetics worsen infection and recurrence. Memory click. Yeast equals keep it dry.
Question 32. A client with a molar pregnancy is at risk for what? A. Hypotension only. B. Gestational trophoblastic disease and choriocarcinoma. C. Hypoglycemia. D. Anemia only.
Answer is B. Gestational trophoblastic disease and choriocarcinoma. Rational. Molar pregnancy is abnormal trophoblastic growth that can become malignant. No, I will tell you why this is dangerous. HCG must be monitored for years to catch cancer. Memory, click. Mole equals malignancy risk.
Thank you for watching. If you found this video helpful, please like, subscribe, and turn on the notification bell for more NCLEX nursing content. Have questions or want the next chapter, more Gynae and OBS questions, or videos on other NCLEX topics? Let us know in the comments below. See you in the next video.